Okay, so in the part one of this video and part two, we talked briefly about vaginal yeast infection and the symptoms. So in this part, we'll be talking about the causes, the diagnosis, and the treatment. Talking about the causes, there's a good bacteria. Yeah, they call it good bacteria because it is a good bacteria in your vagina. They are called lactobacillus. Now, one of the causes of um vaginal yeast infection is actually antibiotics. When you have antibiotics, that will decrease the amount of this lactobacillus in the vagina. Those antibiotics will be considered as causes of vaginal yeast infection. So that's why we have antibiotics as one of the causes of vaginal yeast infection. Another cause is pregnancy. Pregnancy can also cause vaginal yeast infection. Another one is hormonal imbalances. You have and douches and vaginal sprays. All of those sprays that have fragrance and all of those things will also cause vaginal yeast infection. Another cause is uncontrolled diabetes. Yes, when you have uncontrolled diabetes, it can lead to vaginal yeast infection. So now these are a few causes of vaginal yeast infections. Then we'll be talking about the diagnosis. The diagnosis is actually simple because when you get to the hospital and consult with your doctor and tell him or her how you feel, the first thing they will ask is about your medical history, your family history, your past history, and all of those things. Now, talking about the medical history, they will ask you if you've had vaginal yeast infection before, and if you've had sexually transmitted infections before. They will ask you if anyone in your family has, and all of those things. So that's what I mean by medical history and family history and all of those. Then the next thing the doctor would do is to do a pelvic examination. Now, what I mean is he or she will examine the walls of your vagina and then the cervix. So that's the next thing he or she would do. After which they will now collect your sample, that cells from your vagina will be collected and then taken to the lab for test. So it is after the test that you'll be told if you have vaginal yeast infection or not. Then talking about the treatment is actually dependent on how severe the symptoms are. It could be simple symptoms, not so severe, then you could have complicated symptoms also. So the treatment will actually be based on the symptoms, the severity of your symptoms. Then the doctor will prescribe suppositories, all those ones that you have to insert in your vagina. Follow for more.